All of us would have heard about the little blue pill, which is very famously known as the Viagra. At one point, it was said to be a panacea for erectile dysfunction, but also the controversy associated with it, with a lot of cardiac events associated with the use of overdose of Viagra, I would say, not the normal dose of Viagra. So it's always essential that a prescription done by a proper urologist or andrologist be taken whenever you're taking such medications for erectile dysfunction. Hi, I am Dr. Srivatsan Ramani, consultant urologist and uro-oncologist at apollospectra, MRC Nagar. Today, we are going to talk about erectile dysfunction. Erectile dysfunction is becoming very common in the modern era. The problem with erectile dysfunction is the social inhibition of approaching a doctor in order to treat it. Most of the males usually are very embarrassed about it and try to avoid meeting the doctor as well, unless it comes to a level where it's very difficult to manage. Usually, erectile dysfunction is associated with lifestyle disorders as well. High BMI, which is basically obesity, is one of the most common causes of erectile dysfunction as well. As you all know, that India is becoming like the diabetic capital of the world, and I would say that diabetes currently is the #1 cause of erectile dysfunction in India. A good control of diabetes is very essential in order to, one, prevent the development of erectile dysfunction as well as in recovering from the erectile dysfunction as well. Other causes like psychological, behavioral, and as erection requires a lot of chemical reactions starting from the brain, and this essentially entails that a proper evaluation is needed in order to find out the exact cause and the nature of the erectile dysfunction as well. So, are there any alternative treatments to medication when it comes to treatment of erectile dysfunction? We do have a lot of other alternative managements, including injections of PRP or platelet-rich plasma into the corporal bodies. We have vacuum-erect devices where we use vacuum, which increases the engorgement of the veins in the penis and thereby creating an erection. We do have injectable and implantable medications inside the urethra and the penis, which could be used SOS basis to increase the erection. In addition to that, there are also a lot of surgical measures to improve arterial insufficiency if that is the cause of erectile dysfunction as well. All of us would have heard about the little blue pill, which is very famously known as the Viagra. At one point, it was said to be a panacea for erectile dysfunction, but also the controversy associated with it, with a lot of cardiac events associated with the use of overdose of Viagra, I would say, not the normal dose of Viagra. So it's always essential that a prescription done by a proper urologist or andrologist be taken whenever you're taking such medications for erectile dysfunction. We also have latest iterations and latest generations of similar medications which has lesser side effect potential when compared to sildenafil, which is basically Viagra. So these medications are easy to use, are faster acting, and these medications do not have the same side effects as sildenafil. In addition to all these things, very good statin control, basically to reduce your cholesterol, your lipid profile, all those medications also give a lot of help in improving your erectile dysfunction. And as I already said, a good glycemic control, a sugar control is the most important if you are a diabetic as well. If you are facing any erectile dysfunction difficulties, I would advise you to approach your nearby apollospectra hospital and consult the urologist there. Thank you.